It would have been great to meet you all in New York as planned. However, we are still grateful to gather even on the virtual stage despite COVID-19. Leaving it behind, let me first thank Korean and Japanese civil society for co-organizing today's event. Many thanks to Ambassador Hyunju Oh and Ambassador Yoriko Suzuki of Permanent Mission to the UN for attending the event and KOICA's cooperation for this event. Also, I would like to express sincere appreciation to participants from all over the world who joined this event despite the time difference. As the background note sent to you in advance, since 2016, Korean and Japanese civil society has consistently set the stage for discussing the SDGs implementation. On the official monitoring system for SDGs implementation, the first cycle of SDGs implementation has ended. Now it is time to discuss how to accelerate progress toward achieving the 2030 agenda and realizing the decade of action for sustainable development. But as emphasized in the draft of Ministerial Declaration of the 2020 HLPF, as well as report of the UN Secretary General in May, the COVID-19 pandemic poses a significant threat to the maintenance of international peace and security. This crisis is especially becoming more critical to the poorest and the people in vulnerable situations. In this regard, the Korean and Japanese CSO roundtable was held just an hour before a series of this event. In the roundtable, civil society discussed about the role of CSOs in reducing inequality and eradicating extreme poverty from the perspective of vulnerable groups in corona situation could be and how to adequately prepare for the next pandemic. As we all know, what we need most is strengthening partnership. The pandemic makes it challenging to implement for SDGs, and we cannot combat it alone. We should respond to the COVID-19 based on solidarity and international cooperation. Ladies and gentlemen, in conjunction with this observation, I hope that today's event gets done meaningful for us to strengthen further our efforts to accelerate the achievement of SDGs 16 and 17. Once again, I wish for this time to draw significant outcomes, creating peaceful and inclusive society between Korea and Japan, and to cooperate more closely between the government and civil society of the two countries. Thank you very much.
Thank you. Thank you, David Yu, for your very warm and welcoming remarks. So now let me introduce the first speaker, Aoi Horiuchi from Japan. As you know, this is the fifth, the Korea-Japan Civil Society Forum. First one was two in New York, 2016-17, and third one in Seoul, and fourth one in Tokyo, now online, you know. Aoi, you have been to, how many the forum you have been to? You have been to all the four previous forums, or this is a...
No, I started joining the session in 2017.
17?
Yes.
Yeah, okay, good. because I'm very honored to be a moderator of this session because I've been to all from the beginning, to New York and Seoul, Japan, now online, So I'm very happy because more people can join, because of this online, even better than New York, better than Korea and Tokyo, paradoxically. Okay, now Aoi, you have a PowerPoint presentation, right?
Yes.
So you have a 6 or 8 minutes, please.
Yes, but I need to share my slides, but
Yes,
I can't by the host. Can you change the setting?
Okay,
Meanwhile, I'd like to introduce myself.
Okay,
my name is Aoi Ryuichi. I'm an advocacy coordinator of Japan Nature Center for International Cooperation. And I'm working as a advocacy staff. I work closely with Japanese colleagues at the Japan Civil Society Network on SDGs.
We call the JANIC, right? JANIC.
Yes.
So very, there are a lot of similarity between Japan and Korea. We have a JICA, JANIC, KOICA, KCOC. So these are like a family, cousin. Okay, now we have a PowerPoint.
Yes, thank you. This is my PowerPoint slide. So next please. Oh, should I do that? No, please go to the next.
Okay, yeah, now it's okay.
Yes. First of all, I'd like to highlight that we have already been aware of health issues, including non-communicable diseases and communicable diseases, such as, if you look at the SDG goal 3, for example, target 3.3, they say that we need to end the epidemic of AIDS, tuberculosis, malaria, neglected tropical diseases, and combat hepatitis, waterborne disease, and other non-communicable diseases. And we also have target 3.8, which says that achieving universal health coverage, and also target 3.B, development of vaccines and medicine for the communicable and non-communicable diseases. This is all written already in SDGs, which was adopted in 2015. And it's already 5 years, or 4.5 years since the adoption of SDGs. And I think many of the governments in the world and civil societies, trade unions, private companies have already tackled with these issues. And as COVID-19 shows, there are many, many more issues, social and economic and environmental issues, which was caused by COVID-19. So we really need to go back to the basic, or back to SDGs, where all the prescriptions have already described. The next, please. So let me explain how the government of Japan responded to COVID-19, both in domestic and international operations. Next. The border controls, beginning with China and South Korea, that they closed the border in February and March. And the Prime Minister Abe asked to close all the schools in late February, but with no preparations. So it caused a massive confusion among children and also teachers and the parents, especially with small children. And the government started financial packages and for companies, workers, and the individuals. However, the procedure was under criticism because of very, very complicated applications and the too little amount for compensations, as well as a slow pace for distribution. Actually, not half of the populations are covered, only half delivered the compensations. And there's also a criticism on unclear procurement. Then the two washable masks, cloth masks are delivered to every household. However, there's no scientific basis. And there are lots of, there are many expert advisory panels who suggest scientific and medical issues on responding to COVID-19, but the roles of those panels are unclear. And few safeguarding measures for privacy on confirmed cases. So some communities are really afraid that they have confirmed that their privacy would be revealed. And though all the key figures on confirmed cases were published, it was really difficult to access. I mean, difficult to understand if you look at the home website of the Japanese government. And it was actually much little bit improved in June. However, there are several good things the good responses that the Japanese government did. They were quick to publish guidelines for operating shelters in line with COVID-19 responses, especially in those times. Japan had been hit by heavy rains, and many people are evacuated in the shelters. So those people who are in shelters or who is operating shelters, they are leading the guidelines for operating in line with COVID-19. And the government also pressed the act accelerators, Gavi Alliance, CEPI, WHO, and other UN agencies. This is a really good initiative for the international corporations. The next. And then how Japanese civil society responded to COVID-19. Let me explain some cases from civil societies. They distributed foods, emergency goods, water, sanitation, educational materials to children, both in Japan and the big countries. And we also had a policy dialogue with member of parliament and give policy recommendations to the government. And those pictures show that Japanese civil societies, responding. For example, teaching to wear personal protective equipment in Uganda, and also distributing foods and demonstrations for washing hands. However, as a civil society, we always have to ask ourselves if those people's rights are respected. The rights for health, rights for information, or rights for environment, and rights for safety, or rights to move freely. The next slide. So what can be improved? As I said in the beginning, we need to go back to the basic. We need to go back to SDGs. And here are two key SDGs goals to solve different issues and challenges of COVID-19. The first one is goal 16, peace, justice, and strong institutions. And here are key targets for improving accountabilities. For example, if you look at the 16.6, target 6.3, it says promoting the rule of law at national and international levels and ensure equal access to justice for all. And 16.5 says reducing corruptions. And 16.6 developing effective, accountable, and transparent institutions at all levels. And also 0.7 ensure responsible, inclusive, participatory, and representative decision making at all levels. And the next slide. Next one is 17, partnership for the goals. And key target again is 17.2. It means says that reaching the target of 0.7% of ODA to developing countries. And also 17.10, encourage and promote effective public-private partnerships and civil society partnerships. The next slide. Okay, so what can be improved based on those SDG 16 and 17 goals for effective institutions and better decision making? First, we need to put SDGs at the core of responsive measures. We need transparent, inclusive, responsive decision making with scientific evidence. And we need to have close consultation with affected communities and social groups, such as parents with children, youth, essential workers, LGBT communities, and foreign students. Next slide. This is the last slide. And the government should invest more on education, health system, social protection, and public administrations. And also raise awareness for international corporations among citizens and commit to mitigate the impact of future pandemics. And also continue support for international organizations. As the UN Secretary General says, put SDGs first. We are all in this together. We need to solve these issues by using SDG, referring to SDG 16 and 17. Thank you.
Okay, thank you, Aoi, for your very concise presentation about how COVID-19 can be addressed within the framework of SDG, especially the goal 3, 16, and 17. I think after listening to your presentation, probably if we, international community, both government and civil society, implemented the SDG good enough, we could have prevented, the negative impact of this pandemic, because it's already there, the goal 3, goal 16, 17. So this is a very good, important findings, you know. The SDG can be the central frame to address this COVID-19 pandemic. So this is from the Japanese experience. Let's move to the South Korea. Shin Jae-eum from KCOC. As I said, you know, KCOC, JANIC, these are the two national platform of CSOs working on ODA, Internet Development Cooperation. Shin Jae-eum, you have also 8 minutes for presentation.
Okay, thank you. Hi, my name is Jae-eun Shin. I'm Director of Policy Center of KCOC. Today, I'm going to talk about how Korean CSO respond to COVID-19 and the challenges from implementing SDGs 16 and 17 in the context of COVID-19. I will cover the response in the field of international development cooperation and SDG 17 only. The contents are divided in 5 parts. And if you are not familiar with KCOC, please refer to the following information. Next. This graph shows the situation and responses to the COVID-19 in South Korea and global level. And you can also see the responses from Korean government and Korean development CSO, including KCOC below. Next. Since the outbreak of COVID-19, Korean CSO have been supporting 4 areas. First, promoting preventative behaviors and supporting the livelihood of the vulnerable groups and supporting psychosocial services and education. Next. Now you can see the activities of our member organizations here. Next. The KCOC's responses can be divided into 2 categories: capacity building for CSOs and advocacy and campaign. Next. For capacity building for CSOs, first, we prepared knowledge sharing materials such as webinars about infectious disease. Next. The second one, we prepared experience sharing. We conducted online interviews with the CSO activists, remained in 14 countries, and we shared the videos on YouTube. Next. The third, for information sharing, we published weekly country report on current situation in developing countries from April. In addition, we share the relevant information, trends, and research reports and news, so CSOs can understand the situation and influence of COVID-19, not only in domestic level, but also international level. These materials help CSOs to accumulate knowledge and to prepare for future responses and activities for the project sites. Next. Now for the advocacy and campaign. On April, we published the first statement, which was more like an appeal than an assertion. In those days, because the coronavirus hit Korea severely, there was no atmosphere to help developing countries as we are forced to focus on domestic responses. Thus, we appeal to the Korean government and the public to pay attention to the response of the vulnerable in developing countries and request our government establish a consultative body of the government and the civil society on fighting COVID-19 in developing countries. We continue to ask partnership in May again. Our second statement is that we will propose and request external cooperation, including the government, businesses, and private fundraising agencies. Our proposals amounted to 64 countries and approximately $51 million and 170 projects. In addition, KCOC participated in the global campaign of A4SD, such as a signing of a joint statement, civil society to the UN and head of the government, and adding hashtag stronger together on the COVID-related SNS post as well. As a result, the government decided to open the fund for the Public Civil Society Partnership Program for response to global COVID-19. It amounts $8 billion in 2020. In
sorry,
particular,
Jane, are you sure it's $8 billion? It's a lot.
oh yeah, 8 billion won. Yeah, increase.
Yeah,
Sorry.
it's almost
Thank you for
1,000 times.
Okay.
This is a budget for World Bank, you know.
Oh, yeah. Yeah, thank you. Yeah, and in particular, Ministry of Foreign Affairs and KOICA put a lot of effort into the funding opportunity open. Now, I would like to talk about the issues, dilemmas, and challenges. First one is the effective partnership. Then how is the partnership between the Korean government and Korean CSOs? Partnership depends on how the government perceives CSOs. Korean CSOs have been regarded as actors, needed unilateral government support and regulation, and CSO participation has been either perfunctory or limited for 20 years. For example, the proportion of government's public-private partnership over the past 5 years has averaged only about 2 or 3% of total ODA budget, even though the budget has been increased continuously. This contrasts with the OECD DAC member countries' spending. The government-civil society partnership took a dramatic turn in 2018 when the government accepted the OECD DAC peer review's recommendation for civil society partnerships. As a result, our government prepared a policy framework with civil society in 2019. In this atmosphere of the partnership, the COVID-19 occurred. As I mentioned before, we have continuously appealed and emphasized for our government to engage in response to the global COVID-19 with CSOs. And it took 3 months to be realized the partnership. While there is a 3 months gap in cooperation with government and the civil society, the government's willingness and determination to cooperate with society this time clearly differ from the past. We hope this cooperation will serve as an opportunity to secure justification for expanding partnership with civil society in the future. Let's see the partnership with the local CSO in Korean government and Korean CSOs. KOICA's local CSO support project began in 2012, but was suspended after the government and civil society partnership had been in crisis between 2016 and 17. Korean CSO have continued to ask to reopen the program, but it is not yet open. Meanwhile, Korean development CSO partnership with Korean local CSO is being attempted by about 20% of the number of organizations, but the volume is very low level. So localization have become an issue that both Korean government and the CSO should consider and pursue in the future. Next. Let's move on to the second issue, ODA. The Korean government included the COVID-19 response plan in its 2021 annual implementation plan for international development cooperation. Its strategy is 3 directions. First, health and medical capability, and economic and social resilience, and third, ecosystem. As you can see the picture, the COVID-19 affects not only health, but also all SDGs. We need to apply whole of SDG approach in addition to solidarity and cooperation between the government and the CSO to respond to the challenges
You need to really wrap up
effectively.
because we already passed the time.
Okay, I'll finish in 1 minute. From this perspective, the government needs to expand its view on COVID-19 response. It is also necessary to set the stage for monitoring and evaluation the consequences of the Korean government's support and intervention with civil society. In doing so, the government's global COVID-19 response will be acceptable and supported by more local people, stakeholders, and the public. This is the end of my presentation. Thank you very much for listening.
Okay, thank you for your also very concise presentation. So let's, without further ado, let's move to the Ambassador Yoriko Suzuki for your presentation. Okay, Minister Yoriko Suzuki, you have also 6 to 8 minutes, please.
Good morning and good afternoon, good evening to all and my colleagues. Well, it is my great honor and pleasure to join in this event. Thank you for the invitation. I would like to express my appreciation to the organizers of this event. And also, I would like to commend your countless contributions to achieving our common goal of SDGs. Actually, I renewed my appreciation after listening to the previous session. Well, COVID-19 is causing a serious human security crisis, spreading across borders, striking the weakest segments of society, and threatening their survival, livelihood, and dignity. The pandemic has reminded us that infectious diseases cause a tremendous impact on the entire spectrum of human lives, society, and economy in such a short period of time. Of course, efforts to achieve the 2030 agenda are also negatively impacted by the spread of COVID-19. Nevertheless, I believe Japan and Korea are among the few countries that have avoided the worst effects of the pandemic so far, and it would be worthwhile to share our experience in our global efforts to fight against COVID-19. In this sense, this event is a very good one. No country can fight the pandemic alone, but countries need to act hand in hand together. In our response to international appeals by the United Nations and international organizations, Japan has demonstrated solidarity by providing assistance to developing countries in partnership with all stakeholders, including civil societies, since the beginning of the outbreak. Within that in mind, I would like to make 3 points in relation to our experience and lessons learned from our government's response to COVID-19 in light of SDGs on the international fora. Firstly, on the target of our assistance, I would like to touch upon our response to women and children. They are often placed in vulnerable situations, which have been exacerbated by the pandemic. As past infectious disease outbreaks have shown, a targeted intervention is urgent and essential. The government of Japan decided to provide a total of $4.5 million in assistance to the 4 Women Regional Project to prevent infection and mitigate the impact of COVID-19 on women and girls. These projects include the provision of cash assistance, goods and services, as well as information on disease prevention and response, such as prevention of gender-based violence, reaching more than 3 million women and girls directly and indirectly. For children, Japan provided emergency assistance of $28.8 million through UNICEF in March to assist countries prone to the impact of COVID-19 by providing children's access to quality health services. In April, Japan decided on an additional contribution of over $68 million to UNICEF. The assistance projects include not only the provision of medical goods and the capacity building of healthcare workers, but also for services to provide safe and appropriate quality alternative care for children without parental care. More than 80% of those children without parental care in 15 Asia and Pacific countries will have access to a safe environment to grow, learn, and play. Moreover, 25,000 separated children will also have access to quality alternative care in 30 Middle East and African countries. Secondly, I would like to talk about the partnership with civil society organizations. The government of Japan places great importance on community engagement while implementing these assistances. This is where CSOs have many roles to play. I would like to touch upon how effectively CSOs, governments, and international organizations can strengthen partnership to ensure that no one will be left behind. CSOs have played a significant role in incorporating various perspectives of people representing diverse communities to the 2030 Agenda. CSOs are also effective and efficient partners to implement projects all over the world. For example, through Japan Platform. This is an international emergency humanitarian aid organization comprised of NGOs, the business community, and the government of Japan. Through this Japan Platform, we supported projects in 18 countries and regions in Africa, Asia, and the Middle East. Also, SDGs Japan, another platform, has been an important partner for the government to promote the implementation of the 2030 Agenda. The COVID-19 pandemic has amplified the relevance and urgency of delivering on our pledge of no one will be left behind, while posing significant operational challenges in achieving the 2030 Agenda. Recognizing that COVID-19 pandemic necessitates flexibility, the government of Japan supports CSO partners in navigating the impact of the disease, including through allowing reprogramming to incorporate additional components in response to the crisis. We need to continue and enhance this collaborative relationship. Thirdly, I would like to mention the sector of our focus, the importance of universal health coverage in a response to COVID-19. Secretary General Antonio Guterres identified the need for new urgency in support of universal health coverage, highlighting that UHC is now more important than ever. Japan has consistently led efforts to achieving UHC for many years. As a chair of UHC group of friends, Japan with the WHO, Thailand, and Georgia held an HLPF Side-event on COVID-19 and the UHC on July 9 last week, where we reconfirmed the importance of UHC for responding to the pandemic. UHC and a resilient and effective health system is one of the most critical factors in combating COVID-19 so that we can build back better to fully implement the 2030 Agenda. It will remain crucial for preventing the recurrence of the pandemic and minimizing its social and economic impact. Japan will continue to promote the UHC together with the United Nations, member states, and CSOs. Before concluding, I would like to reiterate CSO's critical role in partnership with people who are in vulnerable situations in our implementation of the 2030 Agenda, utilizing their domestic and international networks of the role of CSOs in formulating policy proposals and executing programs is important. It is my hope that CSOs will continue to play an important role with governments and international organizations in promoting the notion of human security and the importance of UHC in the pursuit of achieving the 2030 Agenda while we fight against COVID-19. I expect that today's event will contribute to enhancing our collaborative relationship. Thank you for your attention.
Thank you, Minister Yoriko Suzuki. Sorry for the technical problem again. Okay, let me invite Ambassador O to make a presentation from New York. So you have over 6 to 8 minutes, please.
Thank you, Mr. Anselmo Lee. Good to meet you all, even virtually.
Yeah.
I'd like to send my greetings from New York to all who I have met and worked in Seoul. I hope that everyone is very well and healthy, and more importantly, stay resilient. And
Yes,
if not for the pandemic, we would have gathered in New York.
right. Yes, right.
But certainly not with this big audience. I think it's we saved the travel expenses and we
Yes.
contributed a little bit of reducing CO2. So
Yes, right.
in a sense, there is a silver lining to this crisis. COVID-19 has indeed pushed us into uncharted territory, as we are all witnessing. The pandemic is not over yet. It's far from over, and the human suffering goes on. So maybe we should now think of the ways how we can live with the virus. So now is the time to reflect where we stand and where we should be headed. So in this context, I think the topic of today's meeting could not be more timely and relevant. So this morning, I'd like to share with you how Korea has navigated through the crisis and how we prepare to recover from the crisis. So I'd like to more focus on the government action towards the COVID-19. You have to see the word trust, yes. So I'd like to sum up as for the Korean response to COVID-19 with 5 letters: trust, which spell yes, trust itself is an important element that can describe Korea's response. Public trust in the government is important, and the government trust in individual action of the public is also crucial in implementing collective actions. So the next slide will show what the 5 letters constitute. So the 5 letters which constitute trust stand for transparency, rapid response, united action, science, and together in global solidarity. Some of the Korean colleagues already might have come across the acronyms somewhere else, but I modified a bit. Mm-hmm. But the essence of the messages will be the same. So each of these 5 letters has an important message worth sharing. So I'd like to explain those messages briefly. So next slide, transparency. This is one of the principles that underpin the actions of the Korean government. From the very early stage of COVID-19, the Korean government tried to keep the public fully informed. Since day one, press briefings have been held twice a day by the chief of the KCDC, not KCOC, KCDC, yeah, and the vice health minister. You can see on the left side of the slide the chief of the KCDC. I can tell it is probably at the early stage of the crisis because her hair was still black. As time goes by, people just saw her hair turning gray because she didn't have time to dye her hair. So she held a briefing every day, and she informed us about the disease itself and the policies and plans taken by the government. And on the right-hand side of the slide, you can see the online one-stop information portal. It has been running throughout the crisis. So next slide, rapid response. The government has acted very fast in response to virus. The government has vigorously traced the virus and identified the infected so that public health capacity would not be overwhelmed by the virus. The Korean government took all available measures to flatten the curve by carrying out robust testing, tracing, and treating efforts, which we call 3 Ts in short. Among others, the massive, innovative, and vigorous testing was the key to successfully flattening the curve. The next slide, United Action. When the first COVID-19 case was confirmed in a neighboring country, the government started working in unity with the research institutions and private companies to prepare for the outbreak. This united action helped Korea to quickly develop and supply test kits. Public awareness and the civil participation were also crucial. The Korean people were very eager to remain informed of the nature of the virus, as well as how to prevent the spread. They have actively employed personal hygiene and sanitary measures and have faithfully followed the government recommendations, such as voluntary testing, self-quarantine, social distancing, and other timely protective measures. And also, we have to note that there were always medical volunteers who risked their safety and willingly provided a helping hand to patients in COVID-19 hotspots. Next slide, science. I cannot emphasize more the importance of science-based approach. In dealing with the health crisis, the government has adopted an approach based on facts, data, and evidence. So policies and decisions made by the government was based on the advice of health experts, scientists, and IT-savvy professionals. So with such an approach, we are able to induce drive-through and open-air walk-through testing stations to accelerate test results and develop relevant mobile application to facilitate effective monitoring. Next slide will show the last principle, together in global solidarity. COVID-19 is a global challenge, so it does not respect national borders. There is no simple other option but to work together in our response to this pandemic. So President Moon Jae-in pledged in his special address for the 73rd session of the World Health Assembly that Korea would provide humanitarian assistance worth $100 million this year. And we have provided assistance of PPEs to 97 countries, and we are sharing and will continue to share our experiences and our data accumulated during the outbreak with the international community. In this light, the Korean mission to the United Nations has recently launched a group of Friends of Solidarity for Global Health Security, alongside Canada, Denmark, Sierra Leone, and Qatar in New York. And I'm glad that Japan has already on board in this group of friends. We hoped that the group would serve as a robust, the previous one, go back to the previous one. We wanted that this group of friends will serve as a robust platform for the UN member states to examine the wide-ranging impacts of the pandemic and share how to better respond to the challenges that lay ahead. So as such, we delivered the first joint statement at the open debate of the Security Council under the theme of pandemics and security in July 2020. So next slide. Recently, there was a pilot index of country performance in dealing with the COVID-19 pandemic published by SDSM, a research center which led by the Professor Jeffrey Sachs. As you can see, on average, the Asia-Pacific countries such as Korea, Australia, Japan, and New Zealand have done a relatively good job in responding due to their early proactive actions without too much of a disruption in their own economy. So, and I'm proud to note that Korea was ranked, as you can see, among those countries in terms of effectiveness in the pandemic control. The next slide. Before I introduce how Korea is preparing for the post-COVID-19, I'd like to just share with you the status of the global SDG implementation. It's so obvious that progress has been mixed and lacking in several areas, even before the pandemic. For example, the number of persons suffering from the hunger and was on the rise. Climate change was occurring much more quickly than anticipated, and inequality continued to be increasing.
웨비나 중이라서 조금 이따가 전화할게요.
So next slide. So how the COVID-19 impacted on the SDG implementations. This analysis on COVID-19's potential impact on SDGs comes from the SDSN report, which I just mentioned before. And it gives a rough and preliminary picture on how the current pandemic will affect the SDGs. Just from the visuals, it is so obvious that most of the SDGs will be affected negatively by the pandemic. So making ambition and momentum on the SDGs even more crucial as we begin the decade of action. So next slide, the final one. So how and where should we head? Beyond its response to the immediate aftermath of the crisis, the Korean government is taking this crisis as an opportunity to transform our economy so that we can build back better and greener after the pandemic. At the heart of such efforts lies the Korean version of the New Deal, Korean New Deal, which broadly consists of 3 pillars. Digitalization, decarbonization. But when I just read a newspaper this morning, the plan was just announced today in Seoul time this morning. So the Korean New Deal will consist of 3 pillars. So maybe social security net was added to these 2 existing pillars. So what comes together is the Green New Deal. So this two New Deal consists of the Digital New Deal and Green New Deal. On the front of the Digital New Deal, Korean government is planning to accelerate a transition into a digital economy by digitalizing the national infrastructures while fostering what it called DNA, namely data, network, and artificial intelligence. So what comes together is the Green New Deal, which focuses on investment and job creation in the green sector as a strategy for sustainable recovery. I think it's still the details has been announced, but I didn't have time to follow all the details of the Green New Deal. But the basic premise is clear that we must ensure that short-term recovery measures are aligned with our longer-term ambition to tackle climate change and transition to low-carbon economy. And secondly, at least the Korean New Deal also tells us that we should maintain momentum on the SDG implementations. So UN SDGs, Paris Agreement, and other global framework should serve as a compass for recovery. And most importantly, global solidarity, international solidarity should be sustained and will be sustained. And it is, I think it's a part of our Green New Deal. And I can reaffirm that Republic of Korea will stand in solidarity with all UN member states in combating this pandemic and building back better and greener. Thank you very much for your attention.
Okay, thank you very much for your excellent and concise presentation. We have now received the 4 presentations. Very interesting. Aoi from Japan, and then the ambassador all focus on more the 16 and the plus ODA, and also Shin Jae-eun focus on the 17. So basically, and also minister also focus on the 17. So this is the purpose of this session too. You know how to address COVID-19 challenges in terms of SDG 16 and 17. Of course, the main one is goal 3, which is health. So now, unfortunately, we don't have much time for Q&A. So as I promised, let me read the questions in the chatting room. As far as I know, there are two questions, substantive questions. First one is, I think it's our common friend from Akio from Japan, about aid of foreign sectors, because JICA, KOICA, I mean, both Korea and Japanese government, we provide the grant at the same time loan, you know. So now foreign debt is becoming the big issue now, you know, many developing countries. So what is the response of Korea and Japanese government to this issue of the foreign debt, you know, because the debt cancellation is also one of the campaign for many the CSOs engaged in the COVID-19. That's the first question. It's both the government. Second question is, I think from Africa. How can CSO in Africa can work directly with the CSO both in Japan and Korea, you know? And also Jae-eun in her presentation mentioned about the supporting CSOs in developing countries through the Korean NGOs. But at the same time, they are trying to also develop directly supporting CSOs, the local CSOs in developing countries. Maybe this one can be answered by Aoi and Jae-eun. Let me see, this one more question, right? Okay, this one more, it's a David. David, let me read. We are talking about strengthening the partnership between the government and CSO to accelerate implementation of SDGs 16, 17. This is good, but we need to also talk about partnership between CSO and then Southern cooperation, yeah, South-South cooperation, you know, South-South cooperation. So I hope Aoi and Jae-eun can read this one. How Japan, Korea, and it's a mention about the Philippines, through the South-South cooperation among the CSOs can contribute more effectively the tackling of the COVID-19. Okay, these are the specifications from the chatting room, but I want to also common questions for all, you know. As Minister Suzuki said, no country alone tackle pandemic. It's very clear, right? So now question is global governance, because Japan and Korea is a member of OECD, member of G20, member of many important international bodies, and also Ambassador O mentioned about group of friends strengthening global governance or multilateralism, you know, in New York, Geneva, and also I heard UNESCO, global, you know, citizen education. So how Japan and Korea can work together effectively to strengthening global governance in this, our global fight against COVID-19 as a common question, you know, okay? So let me begin with who wants to speak first? Jae-eun, you want to start first? Since time is very, it's 1 minute each, sorry, 1 or 2 minutes each, because we need also 1 minute for concluding remark and the blessing from Oashi-san from Japan. By the way, can you have only 5 more minutes? Is it okay? Can you have 5 more minutes? I hope it's okay. Yeah, okay, Jae-eun, please.
Yeah, actually, actually one of the participants asked about the South-South cooperation or the cooperation with the local CSO from Japan and Korea. Actually, the KCOC is the council, NGO council, and we are a member of FORUS. It is a FORUS. It is a Forum of National Association. So it has 66 the council organization in this platform. So in this platform, we shared each other and we plan for the network or develop the projects together. So maybe you can join on the network and we can share it more about the concrete action or activities there. Thank you.
Okay, thank you. So if you need more information, you can write to her directly by email. Okay, let's move to Aoi.
Yes, thank you. As suggested, JANIC is also a member for us, so we can also join this network. And also talking about Japanese NGOs, of course, because of lockdown and shutdown of borders, not many Japanese NGO workers are working in African and Asian countries. So they work by email or remote working. They start remote working. I think this is a good opportunity for civil society on the ground to strengthen the partnership between Japanese NGO, Japanese CSO, and also local CSOs. So I think strengthen partnership through online communication is a good idea for tackling with COVID-19. And I think also having a partnership with a governmental agency such as JICA, MOFA, is a key thing because we have been already had good discussions between MOFA and JICA for many years, and we had internal discussion with them for how to promote international cooperation in a time of COVID-19. So by keeping this dialogue also online and offline, I think we can promote our advocacies and our implementation on COVID-19. Thank you.
Okay, thank you, Aoi. Ambassador O or Minister Suzuki? Who wants to the first? Maybe Ambassador O, are you ready?
Yes, thank you very
Yes,
much.
please.
I'm invited to answer two questions, I believe. And the first one was on the debt relief, whether the Korean government is responding to that request internationally. Yes, we take that debt relief issue very seriously, and it certainly is one of the financing the mechanisms for development. And especially after the pandemic, we joined the G20 and Paris Club initiative to suspend the debt payment service. So at least we joined that the suspension of the payment service, and also the Ministry of Economy and Finance has a tool to the rollback to the certain the loans, and already the interest rate is very low and very the long period of grace time. So, and also the concessional rate of those loans provided by government are very, very high. So I think we can actively deal with this request. And on the part of the global solidarity, as I introduced, we have created 3 different global friends group, which are focused respectively on global security and health, as well as the global education. But all together, we are focused on reviving and contributing to multilateralism and preserving the necessity of the multilateral work in this time of the global crisis. So the main purpose of the group of friends in New York was to share experiences and knowledges regarding the pandemic, the current pandemic, also prepare ourselves for the next possible global health challenges. And also, we note that the aftermaths of the pandemic is so wide-ranging. It covers health, not only health issues, but also the peace and security and development, and also the human rights. So, because of this nature of the issue itself, we are trying to discuss every related issue of pandemic, global security issue. So this is going to be very the multifaceted approach. And we, I think that's one of the very good occasions that Japan and Korea join hands. And we, in retrospect, there were some other areas that we were able to work together, but I think this is the time that we step up our joint work.
Okay,
thank
you, Ambassador. Now the Minister Suzuki, please.
Yes, thank you so much. About debt relief, as Ambassador said, we also join the work of the G20 and the Paris Club. Actually, Japan has been putting a very importance on the sustainability of debt since we started ODA, official development assistance to developing countries about 60 years ago. And we always looked into the financial capability of each government when we decide to provide assistance. So this concept remains true, more important during the COVID-19. So we have joined our joint efforts to think about how to relieve the debt to the developing countries during the discussion in the G20 2 months ago, I guess. And the solidarity regarding the solidarity in the international community, I'm very lucky to be in New York working with the United Nations with membership of 193 countries. We can raise our common voice together for the international community. As Ambassador said earlier, we have many friends of groups, and both Japan and Korea joined them. And one example is the UHC group, which I referred to in my presentation. Japan has been a staunch promoter of the UHC, and this is more truer during the COVID-19. So we really want to institutionally build the universal health coverage in many countries, and we are a staunch advocate. And so, as I said in the presentation, we will work on it continuously. And not only the health issue, but the human rights issue is also an important issue during the pandemic. And in the United Nations, we have many friends of groups, like-minded groups on the human rights, development, and peace and security. So recently, we have issued a joint statement on the issue of children under armed conflict, or rights of LGBTQ, and people with disability during the pandemic. And I think these statements can be an advocacy or communication to the international community, so that the governments and people, CSOs or business can put those elements in their policy, in their actions. So that we want to continue with this with the international community here in New York. And let me briefly want to mention of the South-South cooperation, although the question was toward the cooperation of the CSOs. Japan has been a staunch advocate of the South-South cooperation. And of course, we started our ODA international assistance mainly toward the Asian countries after we started. But since the Asian countries have developed economically and accumulated their technical capacity, we started our South-South cooperation toward Africa or Latin America. And one example is, it's not with the Asian country, but for example, we have started a South cooperation with Brazil toward Mozambique, because those countries speak the same language, Portuguese. And so we are very proud of it. It is going very successfully. So we really want to encourage CSOs also to put importance on the South cooperation, because this is a very effective and efficient way to broaden the scope or area of the international cooperation. Thank you so much. Over to you.
Okay, thank you very much, Suzuki. So now, concluding remarks by the Owashi-san. You're from Tokyo, right? Japan, your house. Okay, please.
Thank you. I'm Ohashi. I'm a co-chair of this SDG Japan, or Japan Civil Society Network on SDG. I really, on behalf of the organizers, I would like to really express my deepest thanks to the participant presenter today, especially this second part, especially from the ambassador from government of Korea and the minister of the UN mission from Japanese government. I think there is a wonderful presentation, and I found the common point is that everybody agree no one should be left behind, yeah, as a part of the 2030 agenda. But COVID is also try to not to leave anyone. Yeah? It might infect everybody. So if you want to overcome COVID, we have to get together, and nobody should be left behind actually. But if, you know, I'm a kind of watcher of South Asia. I'm reading a newspaper of South Asia. Bangladesh newspaper sometimes say that you survive, we suffer. Meaning that the rich people, rich countries people can survive. We poor people may continuously survive, suffer. I mean, this is something which we should avoid, right? And without avoiding this, we cannot overcome this pandemic. That's also true. So even the refugees, anybody should be free from corona. So to achieve this, we should really, you know, increase or strengthen our international solidarity or international cooperation or global coexistence. Without those things, we cannot really achieve, you know, our common goal. But sometimes each nation has each agenda, you know, national profit, national goal, national interest might be sometimes, you know, prioritized. That is why Bangladesh was a South Asian country have some suspicion in the era. Now it's a time, you know, vaccine might come up, curative medicine might come up. So we have to break through those things. So that is why we need more solidarity, you know, regardless government or CSO or company, because we have to be liberated from this pandemic together. So we should strengthen our solidarity. This is a wonderful occasion. Thank you very much for your participation. We could really confirm this solidarity.
Yeah, okay, thank you very much for your very wise remark from Japan. So let me share also briefly my own concluding remark. Number one is, Ambassador O said, you know, there's no end of this coronavirus. We need to learn how to live with the coronavirus, you know, which is very much true, becoming reality, you know, whether we like it or not, you know. So the corona started as an epidemic, now pandemic, now endemic, you know. That means a regular, you know. So that means we need to really have the long-term strategy, you know, which is a SDG. That's why, as I always stress, I think we have to put corona within the framework of SDG, especially both ambassadors highlighted the importance of whole of government approach and whole of society approach. But as I put down in the background document, we need also whole of SDG approach, not singling out the one or two, you know, or as a whole, especially the 16, 17, you know. which are the cross-cutting goals, So I think that's the purpose of our session, to highlighting the importance of 16 and 17 as a part of whole of the SDG approach. Lastly, very interestingly, among many others, Japan and Korea, we share the common principles, strategic goal, which is human security. This is and also our president also mentioned the important human security approach. I think around this human security, Japan and Korea can do together so-called South-South cooperation. That means Korea, Japan with the Mozambique, Korea, Japan, Vietnam. That way, while we are addressing our own domestic problems, challenges, at the same time, we can also contribute to the global pandemic. As Suzuki said, no one country, Japan or Korea, overcome this pandemic alone. In that sense, I think this very short, but this is not end. This is the starting of our common collaboration on the pandemic. Let's continue in New York, Japan, here in Asia, our discussion and also collaboration on the ground. Okay, once again, thank you very much for your excellent contribution, and all the organizers, Jaeun, Hani, and all. Let's give a big hands to everybody. Thank you.